We are a provider. Amigo Maybe is a provider of services for the regional center. We have been working with families, mostly Hispanic. When we get a family that is an English-speaking family, of course, we're not gonna decline services to them, but we are very culturally sensitive. We provide the services in Spanish, and we train the families, and that's something that we have worked very hard to do. Most of the families that we work with are with a background, or they work during the day in the agricultural fields, and their academic level, when they are asked, they do not even finish elementary school. So these families have a lot of intellectual problems to understand really the whole concept of the community, where to go, what to do. So we do a lot of education to really empower these families. Like Ann said, it's about training the parents, empower them, and teach them what they need to do, not just on the developmental side, but also on the nutrition, and we do use a holistic approach. So we respect them, we're very culturally sensitive, we build the relationships, and we work with the community. We sometimes go to the doctor's offices because we do not understand what is really going on. The family, when they come to a doctor's office, they're blank. They do not even know what to ask you guys. So we're trying to teach them how to make a list of the concerns that they have, so when they go to your office, they really know what to do, and also be able to write and come back to and talk to the therapist. We have a speech therapist, occupational therapist, physical therapist, and interventionist. Our model is not the type of model where you come in like in CCS, you bring your kid, they work with your kid, they return your kid to you. In our model, we work with the families, and we are taking turns, so by the time that we leave, the parents know what to do, and they can continue to do it many more times during the week. So at the end of the week, they're not just getting 3 times or 3 hours in the week, they are getting 25, 35 hours because they were doing it 3 and 4 hours in the day. So this is the beauty of empowering the families. We have done a lot of events with the families. Most of these families are so poor that we try to do special events for them. We have a big Christmas party where we work with other communities and we give families and the kids some toys and some meals. And also in the summer we do a barbecue party for them. Again, this is something to kind of highlight on bringing some happiness to these families, that every single day, regardless of whether it's raining or not raining or whatever, they are working in the fields, and those are the families that we have been working with. This is basically a summary, and you will find it in the book, of what Ann was talking about. Ann was talking from the rules or law. Here is a little bit more of a dynamic process of how it flows. Basically, initially, there is a referral done, then we do an evaluation, a developmental assessment, whether it's done by us or by another organization. Then the developmental assessment is brought to the regional center, a clinical team evaluates that, plus the medical information and all the rest of the things. Then they decide whether the child is going to be eligible or not. An IFSP is called, then services are started, and then the cycle continues itself. Every 6 months it is reevaluated, and then by 3 years old the child graduates and then becomes the responsibility of the school districts.
Good morning. My name is Noemi Valdez, and you heard from our colleagues here, Deanna Handel from First Five earlier, and you'll also hear from Brenda Hunter, who is the director of the Conejo Valley Neighborhood for Learning program. So you're probably wondering, you may know what First Five is, or you may not know what First Five is. We can go to the next. Thank you. First Five, the voters of California approved Proposition 10, which allowed the creation of the First Five of California. And it is funded by tobacco tax dollars, with matching dollars from all the different agencies that collaborate together in the First Five programs. This is really a partnership, we believe, a partnership between families, communities, school districts, and many different agencies, all in the scope to promote and support and improve the early development of children from ages the prenatal to 5-year-olds. And we do this by working together with the different agencies that we work with to enhance their intellectual, emotional, and physical development. First Five of California and our counties allows for a wide variety and flexibility in our programming. So although we are all very much in line with the goals of the statewide and county programs, there's a lot of flexibility within our programs to meet the needs specific to that community. So you're probably asking, what is First Five, or what does it look like here in Ventura County? In Ventura County, the programs are administered by the Children and Families First Commission of Ventura County, which was established by the Board of Supervisors. It distributes approximately $10 million to the local communities for regional and specified services to each community. The major implementation platform for all of these services to the target population is what is called the 11 Neighborhood for Learning programs, more commonly known as the NFLs. And the NFLs are really the hubs of the communities that they live in, or that they are housed in. And they are the go-to places for families to access services tailored to the needs of that community. There are three primary strategy areas that First Five has implemented and identified for funding, and each one has a specific outcome that is related to the strategy. The first of these is early learning. More than half of the children that walk into our kindergarten classrooms step in without any prior experience or knowledge of any structured preschool experience. And for many of these children, it really translates into limited language and vocabulary knowledge, fewer social interactions with their peers, and most alarming, and you heard from Dr. Taylor earlier, most alarming for parents and for educators is that there are a lot of missed opportunities really for the early identification of children with mild to developmental delays as well as cognitive delays. And the goals of the early learning program are that children are ready for kindergarten and children have access to early interventions for identified special needs. And you heard about some of those identified special needs through the developmental screenings, which we will talk about a little bit later. The Commission also recognized that family dynamics and health play and have a real effect on school readiness for children. The last two strategies of family strengthening and health speak to the need that we have in creating universal safety nets of support systems and best investments for children and their families. And the two strategy areas are family strengthening, and the goal for family strengthening is that families are nurturing and supportive of their children, and in health, that children have access to regular doctors for preventative care, and children have access to the developmental screenings as early as possible. There are 11, as I said, 11 NFLs located throughout the county, and these are identified by the logo that you see down here below. This one is the one for the Oxnard Neighborhood for Learning, but they're very similar, and the only difference is actually that they have the name of that particular community up on the top. As the directors, Brenda is my colleague, we periodically come together, and in a professional learning environment, we gain knowledge and we share our experiences. And you have a list here of all the 11 Neighborhood for Learning programs that are located in our county. The Neighborhood for Learning programs were established roughly to follow the school district guidelines, school district boundaries. So in Oxnard, there are roughly 21 schools. And our NFL program in Oxnard has various hubs within the community that serve all the neighboring schools around the family resource centers. The NFLs receive about 2/3 of the total First Five funding here in Ventura County. They receive the funding. The funding is based on the population and also has extra weight based on need. And some of the factors are the number of children, 0 to 5, that live in the community, the number of children, 0 to 5, that live in poverty in that area, and a few other factors based on academic performance.